Oppositional defiant disorder is a childhood mental health condition involving disruptive behavior that can continue into adulthood. Treatment may include therapy and medication. Nearly every child will have occasional outbursts of frustration and disobedience. Of course, ODD doesn't refer to developmentally appropriate temper, tantrum, or willful behavior. Instead, ODD involves a long-standing pattern of defiant and argumentative behavior or attitudes toward caregivers, teachers, or other adults, vindictiveness toward others, a frequently irritable and angry mood, or short temper. ODD can make it very challenging to interact with other people. Again, the behaviors that characterizes this condition go beyond what's typical for a child's age and developmental stage. Tantrums generally begin to taper off by the age of 4, so you might have some cause for concern when a school-age child continues to have regular tantrums, especially ones severe enough to disrupt everyday life. The symptoms of ODD often begin by the time a child enters preschool, but nearly always by early adolescence. In general, children typically throw signs by the time they enter school. Sometimes these signs only show up in one environment or with one individual. For example, children with ODD might only show symptoms at home with family members or around people they know fairly well. More severe symptoms, however, usually show up in multiple contexts where they can affect social relationships and development along with school or work. In children and adolescents, the most common symptoms of ODD in children and adolescents include frequent episodes of anger, irritable mood, a short temper or touchy mood, being argumentative, a habit of refusing to comply with requests from adults, excessive arguing with adults and authority figures, habit of questioning or actively disregarding rules. Keep in mind that just one or two of these symptoms alone doesn't suggest ODD, especially when they are temporary. Someone with ODD will have at least 4 of these symptoms, recognizable over a period of at least 6 months. ODD generally isn't diagnosed in teenagers or adults, but childhood ODD can continue into late adolescence and adulthood, especially when it goes undiagnosed and untreated. While the general symptoms remain the same, adults with ODD might also have a lot of anger toward the world, feel generally misunderstood, unappreciated, or disliked, have strong attitudes of disdain or disrespect for authority figures, impatient, have a habit of defending themselves forcefully and refusing to consider feedback from others, lash out at others when they feel slighted, and have low frustration tolerance, have trouble maintaining jobs, romantic relationships, and friendships. It's also worth noting that some of these behaviors are pretty common during the teenage years. As a result, parents and teachers might not always find it easy to tell the difference between milder symptoms of ODD and more typical teenage attitudes. What causes ODD? Experts haven't found one single cause of ODD. Instead, they believe it likely develops due to a combination of different factors, including genes, environment, personality, and temperament. Research suggests genes are responsible for about 50% of child's risk for the condition. Children with a family history of depression or ADHD also have a higher chance of developing ODD. Some brain imaging research from 2016 also points to differences in some parts of the brain. These parts help regulate impulse control, problem solving, social behavior, and empathy. These irregularities may factor into the development of ODD, especially when combined with other factors. Many environmental factors at home may contribute to ODD, including harsh or permissive parenting, negative reinforcement for problematic or disruptive behavior, which can promote future acting out. Inconsistent or neglectful parenting, having a series of caregivers, especially ones who offer inconsistent or detached care, rejection from friends, violence and abuse in the home or neighborhood, stressful or unpredictable home life, living in a low-income household or underserved community. Both nature and nurture contribute to personality. A traumatic or difficult childhood can affect a child's temperament and personality and make it more likely they will go on to develop ODD or another mental health condition. Understand too that people with ODD often don't recognize their own behavior as defiant or oppositional. Instead, they might simply believe they are reacting to unfair circumstances or unjust demands from parents, adults, and other authority figures. ODD can cause distress for the people living with the condition and the people they interact with most often, like family, friends, and co-workers. Symptoms of ODD can have a negative impact on social interactions, family life, participation in school, performance at work, ability to hold a job. What's the difference between ODD and conduct disorder? Conduct disorder involves behavior that consistently violates rules, social norms, and the rights of others. People living with conduct disorder don't just show anger. They often break rules and laws, show aggression toward people and animals, deliberately destroy property. ODD might involve some destruction of property, but this generally happens during an outburst rather than intentionally. If you enjoyed this video, subscribe, like, share, and comment.